There's no one reason which causes people to become homeless. There's a variety of reasons, and each individual situation is unique to that person. We see a lot of drug and alcohol use. Mental illness is huge. We see a lot of women fleeing domestic violence. With our veterans, we see a lot of trauma and PTSD. But we also see a lot of people who moved to the area, they had a job, the job fell through, they missed a rent payment, and then they're on the street. And it's very hard once you get into that cycle to break out of it. So it's really a broad spectrum of what we're seeing, which adds to why the issue is so hard to tackle, because there's no one, blanket answer to a really complex issue.
People are they look at law enforcement as they call 911 about a problem, the police come out, either arrest somebody or they don't, and then they're off to the next call. And to find out that we're actually trying to problem solve and not necessarily take somebody to jail, but try to get them connected to services so that we try to break that cycle. One of the ways that we do that is actually going out in the field, and that's why we have the embedded social workers, so that they can actually go out with the police officers and meet people where they're at, out in the encampments and out on the streets and in the doorways and the alleys where we're seeing a lot of the chronically homeless.
Partnering law enforcement and a social worker, it frees the law enforcement officers up to do what their job is, the highly specialized training of a police officer, whose job it is to help immediate safety concerns, as well as community safety, individual safety. And a social worker is the link between that person on the street and the social services that are available.
I always viewed my job as to be that bridge gap between law enforcement and social services, with the ultimate goal of improving lives, reducing recidivism, saving money, and improving access to services.
It's tough for me, as somebody who's successful in my job, to navigate these systems. I can't even imagine how it is for people who are dealing with substance abuse and mental health issues to try to navigate these same systems.
There are some individuals who are ready for treatment and housing. There are some individuals who need some motivation, and there are some individuals who want nothing to do with treatment or housing. And that's why the combination of enforcement and outreach makes sense, because you can offer opportunities to those who are ready.
I can get you into detox, I can get you into treatment, I can get you around and access all these programs, but at the end of the day, where are you actually going to be?
A lot of percentage of people down there are decent people who are just down on their luck and need some help. Substance abuse issues obviously is pretty rampant, but doesn't make them bad people. And if we can get those people into housing, we have a much better chance of actually trying to stabilize them and get them some sort of treatment so they actually get back as a functioning person within society.
Homelessness affects the entire community, and it affects Providence because it makes people more vulnerable to disease and being injured. So they're more likely to come into the emergency department and less likely to be able to have a plan in place to keep them healthy and out of the emergency department.
We knew we were seeing lots and lots of people over and over again, and we weren't really able to do anything for them. The tools we have are really medical in nature, and they don't necessarily address substance abuse issues or mental health issues, and so our only play to run on these is taking them to the hospital.
The emergency department does a great job saving lives. It's what it's built to do. It was never intended to be all there was for people.
So at the jail, we were seeing an influx of specialty housing, people on detoxing, people with mental health issues, that they were there on minor charges. So my issues sort of coincided with the CHART issues, and that was, we needed to find a solution.
So CHART is a way to address a very specific problem which is those individuals who are in the criminal justice and emergency response system who are very expensive and are repeatedly using those systems to address long-term needs of behavioral health and medical issues.
If you're a homeless or chemically dependent or somebody with mental health issues or all of the above, we started to break down how much they were costing for all the emergency services to deal with that individual on an annual basis.
We definitely want folks to get the help that they need, but while we're doing that, we need to take a look at the impacts to the system. We want to see a reduction in our utilization of things like EMS, our law enforcement, days spent in jail. We want to see all of those things come down. Those things are expensive, and when we start pushing the money across between the systems, we're not doing anybody any favors.
Our hope is to find the services and the support and the housing that these people need to actually address the problems that they have, and not just keep throwing expensive programs at them that just aren't working and they're not helping them.
We all work together to try to think of alternative approaches, come up with new ideas, do some brainstorming on what is actually working and what's not working. And the beautiful thing about CHART is that once something that is identified as that's not productive, not working, we stop doing it. And we start doing new things that are going to work for this person.
We're forcing the community to have the conversation now. And it isn't just to point fingers, it's to actually say, we as a society need to come up with a solution for this new and growing problem. And there may be another problem in 10 years that we're going to have to visit, but currently the CHART initiative is visiting the individuals that are costing us the most money in our community.
Every time we prosecute somebody, it is expensive in terms of our time. It is expensive to put people in jail. It is a lot of resources that we spent on an individual to get no change in behavior. And the resources may be worth it if they're effective. But with the individuals in CHART, we spent all this money, we've put these people in jail, we've prosecuted them, and nothing has changed. And so that expense is not worth it if you don't get the results. Whereas CHART, we've seen very effective results. It has cost money, but the money's being spent on housing and treatment, not on jail, and we're seeing greater results.
We recently just did the first evaluation, and what we found is for the first 6 people that came through CHART, we have seen dramatic decreases in their use of fire services, emergency medical services, law enforcement contacts on the street, days in jail, bookings into the jail, as well as use of our homeless shelter and some of our other emergency systems.
The #1 challenge of the people who are identified for CHART is lack of available housing. We can divert people out of the criminal justice system. We can provide them resources when they're in the jail or the emergency room. We can provide resources in our police department and fire department at first touch. But if there's no place to divert an individual from these more expensive systems, then they will repeatedly use them to meet basic needs.
We need to stop shuffling the problem around to a temporary shelter or a mental health counseling. Those are all wonderful things, but when it comes down to really helping people stabilize for the long run and join back into the community in a way that I think most of them really want to, we need to provide them that foundation to kind of pick up those pieces and move forward. And housing is kind of the key to that.
I think it's really important that the community has a range of housing options. There's some folks that are homeless that really need deposit assistance and a reasonable rent they can afford, maybe some help getting a job. There's other folks that may need a little longer case management to kind of address some issues, maybe get sober, get into counseling. And then there's a subset that really will need permanent supportive housing. So that's a housing program where there will always be resources available, support staff, on-site medical services to keep those people housed and stable.
Well, so far with CHART, we have been utilizing the scattered site housing model. And in our community, there's less than 2% rental vacancy, which means there are no private rental market units for these individuals. This highlights the need to build a capital facility that will be low barrier supportive housing for this population.
Low barrier housing, the basic premise of it is that we are going to house you first, and then we're going to address some of the other issues that maybe led to your homelessness, mental illness, chemical dependency, you know, all those other things. But the old model says first you have to jump through all these hoops and then you can earn housing. That doesn't work with a lot of our homeless population.
Some of the people who are in CHART right now are on the street. And I ask you, is it better that you see them on the street and then in jail for a couple of weeks and then back out on the street? Or in a location, in a home where they are receiving services, where they go home every night, where they have proven in other locations to have greater health outcomes, greater sobriety support, greater treatment of mental illness. And so those individuals are not having the same impact on the community as they were when they were on the street.
Giving people a home will really affect everyone in the community, not just the folks that move in, but also Everett citizens, I think, will notice a real difference.
As we began to explore this idea, a team from the city has visited Seattle, Bellingham, looked at other communities around the country, having learned a lot about what they did in Utah. And we see that the impact to the neighborhoods in all of these other places where they've built this facility has been positive.
These are your fellow Everett citizens. Their last address is usually an Everett zip code. It's hard to sometimes think of people who don't have a home as being your neighbor, but even if the streets are their home, they're still your neighbor, and they're from this area. So putting in services is not going to draw people, it's going to help our neighbors right here in Everett.